we alerted the world on January the 5th. Systems around the world, including the US, began to activate their incident management systems on January the 6th. And through the next number of weeks, we've produced multiple updates to countries, including briefing multiple governments, multiple scientists around the world. In the initial report was a cluster of atypical pneumonia or pneumonia of unknown origin. There are literally millions and millions of cases of atypical pneumonia around the world every year. In the middle of an influenza season, sometimes it's very difficult to pick out a signal of a cluster of cases. In fact, it's quite remarkable that such a cluster was picked out, 41 confirmed cases ultimately in a cluster in Wuhan. When WHO issued its first guidance to countries, it was extremely clear that respiratory precautions should be taken in dealing with patients with this disease, that labs needed to be careful in terms of their precautions in taking samples, because there was a risk that the disease could spread from person to person in those environments. The imposition of flight restrictions by countries is the sovereign right of any member state. WHO does not control the law on this. WHO's only function under the IHR is to challenge member states who put in place restrictions to ensure that they have a public health justification for imposing those restrictions, and that we are bound then to share those justifications with other countries who may be affected by those flight restrictions. That is the role of WHO.